Where will my incisions be? Facelift incisions are typically concealed around the ear. Most people have creases in front of their ear just from natural aging, little lines where my fingernail is. We can hide them in those creases. Sometimes we put it along the edge right here, or actually inside the ear, as we say, and it can curve down around the earlobe in natural lines so that you'll barely see anything. The real goal is so that your hairdresser won't even see it when it's done healing. I've had patients of my own that have come back after an appropriate time frame of healing where I can barely see the incision and I put it there. But it's normal for them to be red for a short period of time. I've had TV anchor women that have been back on TV in as little as 3 weeks after more extensive surgery than just a face or neck lift. Now people say, well, what's a facelift? Some people use that term very loosely. You can do just the neck with an incision hidden behind the ear. You can do just the mid-face with meticulous incisions around here that are sewn very carefully, or you can get into the forehead. So people use the term mini lift. Mini lift generally means a shorter incision. You want to get as much improvement as you can, so we want mini lift but maximum result. The question is, what's involved in a facelift? Facelift surgery is typically done in our own private operating room here. It's done with local anesthesia, in some cases with an oral sedative, but in most cases with sedation given by an anesthesiologist. The sedation is virtually identical to a colonoscopy, so if you've ever had that, they're short-acting medicines. We turn the medicine off and you wake up very quickly. There are meticulous stitches that are placed around here, and I do put a bandage on for the first night, which is removed the next day, typically by one of our nurses. The sutures that are in here are placed and left for about a week, and then they're taken out. Most people look presentable at that time. People from out of town or out of the country that we see frequently will leave at 10 days after the surgery, and we can continue to follow them by Zoom and other methods that we have today.